Hello and welcome back to In the Gray Area with Revv Health. I'm Britni.
And I'm Travin.
And today we're just going to kind of talk about maybe some red flags to be looking out for in regards to providers when you're looking for a clinic to work with.
Yeah, I wanted to do this one just because there's, at least on my side with the guys that I talk to, there's a lot of things that consistently come up that guys have, like when they're working with different providers. There's a lot of patterns I see. And so just kind of wanted to highlight some things to maybe you should be aware of or keep an eye out for with the provider you work with. So like one of the common things with a lot of guys that I work with is estrogen and providers wanting to block estrogen. And so, this, maybe want to talk about this. Just a couple nights ago, we have a patient that we work with, and this does happen all of the time, but he's getting treated by us on testosterone therapy and just got his routine physical blood work done by another provider. His estradiol was high and immediately wrote him a script for an astrozole, which is an estrogen blocker.
High in regards to like what they would consider high.
Yeah, it was outside of the normal range. Mm-hmm. It was red. It was actually a beautiful range. He had a great estradiol number. But so he calls us right away and says, "Hey, my doctor said that my estradiol was high and he wants to put me on this medication." And so we have to have the whole conversation with him. First, explain that an astrozole is a chemotherapy drug, and it's something to lower his estrogen, but it's the main red flag to me if a guy's on testosterone therapy and the provider wants to manage or block your estrogen. That's one of the number one signs to me that they don't understand the medical literature, because what I always tell those guys is, go back to your provider and ask them why they want to put you on that medication, and not just because your estrogen's too high, but ask him, why is that harmful? Because they will not be able to find you any study, any sort of medical evidence whatsoever that shows that's harmful. And not a baseline study, but an actual study where they give men estradiol rather through, either through raising testosterone or giving them actual estradiol and showing them that causes harm. Because in every single study, there's nothing but benefits. And in every study that they block estrogen, it shows harm.
So why do you think their go-to automatically is just to block it? Just because they just do not understand?
It used to be pretty commonplace in the world of testosterone therapy. I mean, and a lot of it does stem from the bodybuilding world where they're using, ultra high doses and a lot of these like synthetic compounds. And it kind of stemmed from that, but it just became popular in the mainstream where it was just kind of commonplace that you wanted to keep a man's testosterone inside of that quote unquote normal range. And a lot of these providers that haven't kind of done their own research or stayed current with the medical literature, they're still kind of following those guidelines.
Yeah, and I think that sometimes even the questions that we get would be like, is there ever a time to block it?
Well, in my opinion, no. I think that if these so-called symptoms that guys come up with, these high estrogen symptoms, it's not high estrogen, it's due to the insulin resistance and the inflammation that they have. And so I think that if you have these quote unquote symptoms, you do things to adjust the therapy to manage those while they're working on reducing the visceral fat and inflammation and things like that. And so you can switch to a compounded cream, or you can adjust the dose or the frequency, or there's a lot of different things that you can do to control those symptoms rather than give a harmful drug that's going to cause harm.
Yes, I think that's really important for people to understand, is that there are just other routes of treatment that we can do.
Yeah.
I think for the ladies, when it comes to estradiol, a red flag would be to first and foremost, before they ever are placed on estradiol, making sure that they clearly are in menopause and that they see that. So looking at their LH and FSH, and before even going, because we see all the time that providers, even providers in our industry that like claim to be specializing, are putting people that are not in menopause on estradiol.
Yeah, I see it a lot.
Yeah, we do. We see that a lot.
Mm-hmm. So yeah, I know you have that conversation with a lot of your women that you see that come in on, estradiol. You see it with a pellet all the time, like estrogen pellets.
And I actually see both. Just like recently when I was at the gym, a friend I hadn't seen forever, she came up to me and she was like, but she was already questioning, even questioning, like she has another functional medicine provider that she sees that was telling her as well, like, you shouldn't be doing this. It's not time for it. But yet her provider was giving it to her already as well. So, and she was getting those negative symptoms of the bitchiness, the bloating, all that kind of stuff.
Yeah. Another one that sticks out to my head is that when the providers are using numbers to restrict therapy or to guide the therapy, like we see it a lot with women, a lot with thyroid, and a lot in men with testosterone, to where they were feeling good, but the provider didn't like their number. So they
Yeah.
lowered their dose, and then, they started being symptomatic again, but basically they're using numbers to guide therapy rather than symptoms.
Which I would say, if you didn't listen to our last podcast, that would be really important to go back and listen to us talk about that more in depth, because we are trained. It's all evidence-based that it's really not about a number. It's about symptom relief first and foremost.
Yeah. Yeah, you're right. I mean, it's with guys all the time. It's, my doctor didn't let me get over, he won't let me get over this number. He makes me stay within this range despite how they're feeling. And it's one of those things that is not evidence-based whatsoever. There's no number that dictates that.
No, but even like with testosterone, say their doctor did put them on a lower dose, they're going to feel good in the beginning for like the first month until their natural production isn't kicking in anymore. And then they're going to feel like crap again. Then they're going to go back to their doctor, and their doctor will not give them any more.
Yeah, that's pretty common, especially in the insurance-based practices with, it's pretty common for guys to be underdosed on testosterone therapy. And so, yeah, like you said, exactly. It's they're put on enough to shut down their natural production, but then not enough to overcome even probably where they even started at. So a lot of times they'll end up feeling worse or not feeling any improvement.
Yeah. Another thing, I mean, we always say, like, practice what you preach. So, I mean, if you're going in and you're working with somebody who clearly is not taking care of themselves, I feel like that's a huge red flag.
Yeah. I mean, that to me should be an absolute no-brainer. I mean, if you're going to someone to better your health, improve your well-being, and they don't look the part, they don't live the part, they're not healthy themselves, like, how could you possibly take them serious? Like, in my opinion, it's just like, the old joke about not taking financial advice from someone that's broke. I mean, it's like, realistically, like, use your common sense, like, go to someone that's where you want to be at.
Yeah, exactly.
Another one I see especially in the TRT clinic space is lab work. I see a lot of places that make their guys do lab work every 3 months. And to me, that, like, you can check if you want to check your lab work frequently, like, that's fine. But in my opinion, it's just a money grab for a lot of these places. They're charging guys for lab work. And so they're making them come in every 3 months, pay for labs. And it's so unnecessary. Get, like we talked about in our last podcast about labs. I mean, if you get someone, like on testosterone, get them dialed in, they're at a good point. Like, there's really no need to keep checking labs. I mean, you can check it annually, that's fine. But as far as the testosterone number, like, what's the point in checking it every 3 months? Just use your symptoms to guide your therapy. But I think that's another red flag if someone's charging for excessive lab work frequently.
Yeah, and sometimes we see the opposite. Like, especially with a lot of our females, they go to their OBGYN and they're like, they trust that they probably know what's going on with their hormones. And they'll ask to, like, hey, can I test my hormones? And then it comes back that they didn't even test anything that's needed to even kind of determine if they're low or deficient in anything. So it can go both ways.
Another big one in the men's space is fertility. Again, like a lot of these TRT clinics. So I see guys that come to us and two things are either happening a lot. Sadly, a lot of guys will come to us and they were not even made aware that testosterone can impact fertility. And so that's a huge just problem in general, that these guys aren't being made aware of that before starting treatment. But there's also another place that guys commonly come to that they're being put on like a gonadorelin peptide, and they're being told that that's going to preserve their fertility while they're on testosterone therapy. And that's completely false. And they're under the assumption that they're taking testosterone, they're taking gonadorelin, and their fertility is not impacted at all. And so to me, that's just almost malpractice that's occurring. And so, I mean, I think that's just something to be aware of. Like, if you're a guy and you're still possibly wanting to conceive in the future, like, you need to have that talk and you need to figure out your options and discuss that with your provider, and also just make the best decision that you can for yourself. I mean, there's options that you can do to still start testosterone therapy and, maintain fertility. So just have those conversations so that that you're doing the thing, the best thing that's right for yourself.
Yeah, I think that anytime you're starting to work with anybody, whether it's your general practitioner or somebody that specializes, just like being completely open and explaining like where you're at, what your goals are, and where you're headed is really important. And sometimes that looks different for different people. So just making sure that you are clear with, like, you may be dealing with PCOS and fertility. Yeah. So, and it might be like both partners. So finding somebody that truly understands like your journey and even takes the time to listen and ask questions. Asking questions is probably really important.
Say. Yeah, asking questions, just asking, why they're recommending the things that they're recommending, and asking them to explain that, and just also that they're not trying to push unnecessarily things on you. You know, I see that happen too, where people get put on all these other extra ancillary medications or supplements. And it's just, to me, is just such a, again, another money grab that places do. And it's unfortunate.
Yeah. I mean, we like to tell our patients less is more sometimes, you know, and let's address the root cause first and then kind of slowly add in some things if needed. So I think that's really important. Just making sure you ask the question, why do you want me to take this? Why am I on this? How is it going to benefit me and my goal where I'm headed?
Yeah. How come it seems that every woman that comes to us that's on pellets is also on DIM?
Yes, that is something we seem to hear. And we also hear the terms like bad estrogen a lot.
Yeah.
And overcoming that is really hard just to explain, because there's so much misinformation out there. And it's generally, I mean, there's no bad estrogen. It is all about balance and regulating everything and getting everything optimized in all levels, not just one area. Because a lot of times those women that are coming in, they just have one pellet and their testosterone went from 0 to like 450. So that's where they're getting pushed with the DIM, instead of understanding that it's really more about balance in all areas, especially with progesterone. Like just a good amount of progesterone is going to make a huge difference.
Yeah, with like bioidentical hormone replacement therapy, you really shouldn't need a bunch of these ancillary medications and supplements and things like that to fix side effects that you're getting. If your treatment's done properly, like, you shouldn't really need all that stuff.
Yeah, it is crazy though. I feel like there was a while that we were getting men and women questioning all the time why they weren't taking DIM.
DIM is another supplement that there is, again, zero medical evidence to support the use. Like, the reason that people are giving it, there's no evidence to support that at all.
It's interesting though, because when I did the pellet, you know, in the beginning, I did like it. And then I had a lot of negative side effects and stuff, but that was the go-to was, you know, we love spironolactone and we stand behind that, but it was spironolactone and DIM, and it was just pushed and it was just like, take this because you're doing this, and not a lot of answers. And
yeah, exactly. So I think, I mean, that's another one I would be aware of. What is there anything else you can think of?
No, I just think that, you know, we're talking about red flags, but first and foremost, I think that it's really important that we talk about it all the time, but it's really important to make sure that, like, if you're taking the time and spending the money to work with somebody or a clinic, a team, that you really do your due diligence in making sure that you think that this is the best route for you, and really trusting your team, you know, whether that's us or somebody else.
Yes.
And if you're making that investment with them, that you trust them just as much as you want them to be invested in you and your health.
Exactly. That's perfectly said. I was going to say the same thing. Like, even if we won't align with everyone, and if someone comes to meet with us and they don't think that, like, we're a good fit for them, then that's great. And that's fine. And they should work with someone that they feel is a good fit for them and comfortable. But like you said perfectly, like, you should, when you make that decision to work with someone, you should trust their guidance, and you should, you know, expect that they have your best interest in heart and that they know what they're doing, and just trust the process. Because, as you know, it can be a process, especially for women. It can take a while. And so it's easy to get discouraged, especially like in the early parts of treatment.
Or frustrated. Yeah. You know, patience are so important, especially for our women, because there's a lot more hormones and a lot more regulating and balancing, and we're still going a lot of times through cycles and stuff. And so finding that, like, happy medium of feeling good and not having a ton of questions, it takes time.
Yeah.
And often we see, like, someone will start the first month and they'll ask a question, and it's like, okay, let's be patient. You're still early on. And then they're Googling, asking other providers, asking all their friends, and then it just causes way too much frustration, and it complicates everything that you're trying to accomplish.
Yeah, I think people need to understand that it takes about 12 to 18 months to get the max benefit out of your hormones. And that doesn't mean you're not going to get benefits sooner and start seeing things, but to really start getting the max benefits, and especially in terms of like body composition changes and like really, really significant, you know, health improvements, like, it takes time. And so you just need to be patient with that whole process.
And that's really common, like, especially for our female patients, like a lot, like after the age of 35, start seeing that added weight around the midsection. And within like a month or two, they want to know when they're going to start seeing that come off.
Yeah.
And unfortunately for us ladies, that is like one of the last things that we really see.
Yeah. Because you still have to put in the work yourself. You can't just take the hormones and expect to magically, you're going to, you know, lean out and start building lean tissue and stuff. Like, it helps these things, and it helps overcome the deficiencies that you've had by having low amounts of hormones. But like, there is no magic pill. You still have to put in the hard work yourself.
Well, that goes back to like red flags. Like if you go to a provider and they're just like laying this out, like here are these hormones that are going to help you without talking about diet and exercise and like changing your lifestyle, then that is a huge red flag because they really are, they all work together and you have to be changing.
You have to do all of them.
Yes.
For sure. Well, I think we covered a lot of, I'm sure there's more that we missed, but I think that's a great starting point.
Yeah. Again, like it's really important just to do your own due diligence when you're looking to work with a provider or a clinic, and I encourage you to do so. Like always, please like, comment, subscribe, and we will see you next time. Thank you.